Integrated Hubs projects in general, as well as the Integrated Hubs project specific to Alberta. We will also comment on lessons that we've learned working with communities over the last year that we've had the privilege of working with them, and how those lessons we've learned have changed the way the call has gone out for this second release. For those of you who maybe attended in the first release, there are a few small differences, but we will be sure to point those out to you throughout the discussion. We'll go through the application process in a lot of detail, both the two streams, the capacity and readiness stream and the plan and prepare stream, and then we will have questions throughout. So to start just about PolicyWise, for those of you who may not be aware, PolicyWise is a not-for-profit organization that exists to improve the well-being of children, families, and communities by collaborating, leading, and creating, mobilizing research and evaluation to then inform policy and practice. We pride ourselves on building long-term relationships with stakeholders that improve the well-being of children and families and communities in Alberta. The Integrated Hubs project for Alberta has come out of the Valuing Mental Health report. So this Valuing Mental Health Review Committee was gathered in 2015, as many of you on the call are likely aware, and this report is what came out of that review. Ultimately, the report called for transformation of both Alberta's addiction and mental health system. Through this review and in the report, a need was identified for integrated youth services that focused on prevention and early intervention, as well as evidence-informed tools, guidelines, and standards to support such services across the province, especially those outside of the major urban areas of Edmonton and Calgary. From the report, there is a corresponding action report, and action number 1 specifically called for integrated hubs. This is how the community-based service hub project came about, and it's who the Integrated Hubs project is accountable to. So after the Valuing Mental Health report, PolicyWise was contracted by Alberta Health to create a framework that would support community-led implementation of these community-based mental health service hubs for youth, which we have called integrated hubs. The specifics of these are that they do need to be located in small to medium population centers, and specifically for Alberta youth ages 11 to 24. The framework that PolicyWise was contracted to create and develop, of course, cannot be developed without community participation. So the entire project is set up to work with communities in a developmental capacity to better understand what it takes to support integrated hubs in the implementation. So this framework that is under development and its associated support outlines implementation considerations, collaborative governance and coordination. It includes both developmental and summative evaluation approaches. And throughout this process, PolicyWise has worked closely with communities to design and build iteratively each community's ideal vision for the hub. In the same process, we've also developed the implementation framework that is supporting new communities. So you can see there's a number of provincial partners, community partners, and PolicyWise all working together to design and build and learn together. It is very iterative. And what comes out at the end is community-based integrated hubs, a provincial operating model, an implementation framework, an evaluation framework to create some provincial consistency to the outcomes that integrated hubs are seeing, and an approach to collaborative governance that is inclusive of provincial supports as well as community supports in a mutually reflexive way. The term integrated hub is one that has a lot of varying definitions, depending on where and who you're speaking with. So for Alberta and for this project right now, when we say the term integrated hubs, we are talking about the integration of health and social services in a youth-friendly environment. It typically will focus on prevention and early intervention, and the provision of resources to help youth manage their concerns and navigate pathways to specialized services as are required. They aim to minimize the service gap between children and adult services by providing a youth-oriented, one-stop shop for youth to access mental health care as early as possible. This definition came out of a very thorough environmental scan that included both academic and grey literature, but as well as extensive interviews from other jurisdictions, internationally and nationally, that are operating integrated hubs. As these integrated hubs are community-based, they are flexible and adaptable to each community's social, cultural, and health needs. It is recognized that integrated hubs are unique and based on the context that exists and the relationships that form in the development of them. And as a result, those services in each integrated hub differ in scope and in the ways that they evolve during this application process. As a result, each integrated hub, as I was just saying, has differed in their scope and the way that they've evolved through the application process. But in order to ensure some provincial consistency, critical elements of the integrated hub have been identified through the environmental scan. Those are that the integrated hub must knit together existing applicable services in communities and in a youth-oriented and accessible space. These services must include mental health supports as a core component and other services that are deemed appropriate by the community. Services need to be developmentally appropriate, trauma-informed, and available for youth ages 11 to 24. And the integrated hubs must be designed with youth and families to reflect their needs and their preferences. Primary health care is another important service to be included in integrated hubs, as it's a fundamental precursor to prevention and early intervention of mental health. Beyond these elements, the integrated hubs are expected to have their own look and feel as they often evolve to meet the needs of the community. So that was a lot of the background phase. We'll move into what we've learned with working with communities, and then we'll pause for questions before we dive into the application process. So in the PolicyWise implementation framework that is being developed with communities, we have 6 stages. This implementation framework has been built on a few different bodies of knowledge, of which implementation science, community development, and capacity and readiness has readily informed this process. The integrated hubs use leading practices and is informed by the environmental scan and the ongoing developmental evaluation to develop this implementation framework. So there are 6 stages of the implementation of an integrated hub proposed in the framework. Exploration and design focuses on determining the need and outlining the vision, identifying partners, and your community-based approach to integrated hubs. Capacity and readiness looks at assessing your community's readiness and organizational readiness to build on and prepare to operationalize your initial vision. It gives you a sense to look at, does your vision align with what you have capacity to do in your community or where there may be gaps? It focuses on establishing a steering committee and securing commitment and service partners. Plan and prepare is often the 3rd phase of this implementation framework, and it looks to taking that steering committee down to working groups and confirming that vision and mission with the steering committee, mapping out service pathways, establishing governance and management, looking at information sharing, developing communication plans and protocols, addressing those operational aspects, and obviously incorporating ongoing monitoring and improvement throughout that process. Initial implementation is the communication and launch of the initial hub. It's the structure for review and the ongoing learning that needs to be a part of that. For review, adaptation, and revisions as we learn as we go. And full implementation outlines the point where you have the service pathways and the operation considerations worked out, and that you are ready to kind of more fulsomely be open and less with the ongoing adaptations. And then ongoing monitoring, adaptations, and improvements is throughout, but it's the ongoing monitoring and support systems, establishing feedback and improvement processes throughout. Our current communities that we are working with from the first call have been working through the first few stages of this network. And as has been PolicyWise's approach throughout this, the developmental aspects and the developmental evaluation has informed this integrated hub process and the implementation framework. For those of you who may have been part of the first call, we did not have a capacity and readiness stage built into the first call, and through our work with communities, we've realized that that's really important, and so you'll see the changes reflected in this application. There's been a few other really important lessons we've learned through working with the communities and through the developmental evaluation that we wanted to share with you as it's important context for your applications as you move forward. So the first is that practice change and working along the continuum of integration are significant milestones. Practice change, collaborative practice, collaborative service, and those types of discussions are important precursors to achieving integrated care. This knowledge has informed that development and has moved to give communities space to celebrate and recognize the importance of having that practice change before moving into integrated service delivery. When we talk about the continuum of integration, the one that we've been using and working from is the one from Boone. Of course, there are modifications to this, but just recognizing that moving along this continuum of integration is a very, very important part of the process, and it needs to be recognized and celebrated within the implementation framework. We do have definitions of each of these steps along this continuum that is in the information package. The second lesson that we would want to share from working with the communities we have been over the last year is that the interpretation and operationalization of an integrated hub is different in each community. Working towards integrated service delivery is very contextual in the community, and as a result, the interpretation changes. Within the critical elements identified through the environmental scan, there are some parameters for provincial consistency. But to some, this has meant a single physical location. To others, this has meant a network and ways of working with multiple access of location. All in all, it is responsive to community needs, and in some rural sites, one physical location could actually limit access, so those communities have adapted to have multiple points of access. The third very key lesson, and it's not any surprise to anyone on the phone, I'm sure, is that the time, resources, and community commitment are foundational to this work. This is probably one of the most important lessons that communities that we have worked with have wanted to share with other communities coming forward. The time, resources, and commitment that are required can't be done off the corner of somebody's desk, and that the implementation and appropriate space have to be created in a way where relationships are respected and fostered to have some of the discussions that come through the implementation process. It's through this discussion that the capacity and readiness stage evolved. The idea that you can't just outline a vision and move into plan and prepare without assessing your community's capacity and its readiness to move forward with it is part of that initial time and resources and that commitment. So we are going to move into the application process. That's a lot of background material I just provided. And just as a reminder, this is being recorded and will be sent out afterwards, and a lot of this information is in the corresponding information package. But before I do so, are there any questions before I move into the next part?
We have a question, Naomi, when you have a moment.
Yeah, for sure. This is great.
I'm curious about the pilot work you've done and how many communities have been involved, and have you reached the stage of on up and running a youth hub in any of these communities?
Yeah, that's a great question. So right now, there are 3 communities that PolicyWise actively works with. One of them is hoping to open its doors in January. It's taken probably the more traditional approach to implementation, in that it does have a physical location secured, and it's just working out the final steps of staffing and operational elements. So it is hoping to open its doors in mid-January. A second community that we are working with is still in the planning processes around what its physical location will look like, but it has made significant strides in terms of the practice change. When we first met with that community, they didn't necessarily even know who their services and partners were, and in fact were introducing themselves to each other at a meeting we were at. They have focused on that practice change, and what they have done is taken staff from the primary care network and embedded those staff in the FCSS office location to continue working on community connections and enhancing those supports before deciding on where their location will be and what services they'll offer. So they're really slowly moving their toes into what is it that their community needs and trying to sort out what that integrated service delivery looks like. The third community is not directly funded by PolicyWise, but is part of the Value Mental Health Initiative. And so they do have one physical location, as well as other access points in their community. PolicyWise is involved with them for their evaluation and for contributions to the implementation framework, but we aren't funding them directly.
And can you tell us how big these communities are and which communities they are, where they are, and so on, so we can kind of get context for it?
Yes, for sure. So the first community, all of them are fairly close to urban settings. The first community is Fort Saskatchewan. The second community I mentioned is a Parkland County, so that encompasses Spruce Grove, Stony Plain, and those surrounding Parkland County rural areas. And the third community is Camrose.
Third is what?
Camrose. Yes. Any other questions about the background before I move on to the application process?
You mentioned that there has to be a mental health element and a primary health care element. Are there any other elements that are required?
No, the mental health care and a stepped mental health care approach and primary health care need to be services included in the hub. However, how those are delivered are determined at the community level. There's no set required partnerships when it comes to that. In terms of other services, we have a list of recommended services and services that tend to be a part of hubs, such as employment services, sexual health, family and community social support. Sometimes there's been food bank elements. There is no other required elements. It really is what your community needs, what your community has available, and what youth and families feel would be the most appropriate in terms of knitting that together to help improve access to supports and services.
Thanks.
So I will provide an overview of the application process in its entirety, and then what we'll do is we will split into discussing the two different opportunities and streams of applications and what we're looking for in each of those different applications. And then we'll have more questions at that point. So the application period obviously opened on November 21st, and we are now at the webinar in that second phase. Applications are due January 28th at 4 p.m. Mountain Standard Time. There will be, this is a very high level overview, there will be a panel review. So PolicyWise is not a part of the decision for the communities that are funded. We have established a panel of stakeholders who, the best way to describe it, mimic an integrated hub. So we have youth and their families on that panel. We have stakeholders and partners from each of the different areas that we imagine are often part of an integrated hub. So we have primary healthcare representative, we have a mental health care representative, we have education, we have children's services, community and social services. We have Indigenous perspectives and peoples on the panel. So it's not all government or ministry, but this panel knits together to follow a very structured review process. Each application is reviewed by 3 panelists, and the scores are then combined and discussed to determine where the next threshold. Scores that receive over a certain threshold and that the panel recommends can move forward to the second stage, then go into 2 different streams. They will either go through a phone interview with PolicyWise to gather further information to help us better understand some of the nuances that might be in your application. If you're in Plan and Prepare, you go through a site visit where we will come and meet with your community partners and better understand. That information then is brought in to further contextualize the applications, and then the panel will make a final decision and recommendation in May 2019. That final decision and recommendation goes to the Child and Youth Family Integration Committee underneath Value Mental Health and to Alberta Health for final endorsement. So it's important that communities determine which application stream is most suited to them based on their current developments. Each community will then select a lead organization to submit the application. However, it's very important that the application is completed in a collaborative or partnership way. The lead agency simply has to be the banker to hold the funds, but Integrated Hub really is a collaborative process. So there should be partners contributing to the development of the application. Applications, as you can see, for both streams are due on January 28th at 4 p.m. And again, we've talked about the fact that it will be sent to a group of reviewers with a wide diversity of people, including youth. And then those decisions will be released in May. All applicants will be will receive feedback from their reviewers, regardless of whether they move into that second phase or that second fork part. So you will receive feedback back from all 3 reviews. The funding streams are open to community-based organizations that are willing and able to lead other agencies in their community to integrate together existing mental health, community, and social services. They're willing and able to adapt services to be appropriate for youth ages 11 to 24. And they're located in small to medium population centers that are typically with a population of 1,000 to 99,999. And that's just using the Step Canada definition.
Naomi, may I ask a question?
Yeah.
How many communities are you guys looking into?
Depends on the types and the nature of applications. We have a limited pool of funding right now, and it will honestly come down to the strength of the applications that we receive. So we could potentially fund any sort of algebra in there of like 2 plan and prepare sites and maybe 1 capacity and readiness. It could be 3 or 4 readiness and maybe 1 plan and prepare. So we have in total probably a capacity to work with about 4 or 5 communities, but it honestly depends on the strength of the applications and which stream they fall into, because there's different funding amounts for each stream.
How much funding is there?
There's a total of 150,000. And so this plan and prepare stream receives 75,000 and capacity and readiness receives 10,000.
That's per community. Per community?
Yes.
Thank you.
So the application process, we'll start with the purpose of each stream. So the purpose of the capacity and readiness stream is to facilitate your communities being able to bring together stakeholders to assess their capacity and readiness. So ideally, you would have a very high level vision of what you think a hub could look like in your community, but you don't necessarily have all the partners on board, and you haven't taken that vision and tested it with your own capacity and readiness. Plan and prepare, the purpose of this is to move communities forward into initial implementation. So it means you already have a steering committee established, you have a well-founded vision, and you have a well-founded sense of what community contributions can be, and you need to move forward into working groups and prepare for that initial implementation. So again, how do you know which stream to look for and which stream to go into? Under capacity and readiness, if you have a few informal working relationships with different partners, but you're not inclusive of all those services that would need to be at the table in order to implement an integrated hub, if you've started having a few conversations about addressing youth and mental health differently in your community, but you don't have a very firm vision of what that could look like, if you have some champions in your community who want to bring together organizations and move people forward in this area of change. So if you have champions in your community, in your organization that can help move this work forward, but you need to bring more people on board and formalize and firm up your vision, then capacity and readiness is the stream for you. Again, wanting to say that this stream came out directly from our work with communities. It takes a lot of work to have the right people at the table, and trying to move this work forward before you have all partners engaged and in a stage of shared readiness, the work can feel like you're spinning your tires. So this is a really important stage, and we're very pleased to have had communities share with us about how important this is and to be able to have modified the process to include it. For plan and prepare, your community has a very firm vision of what it looks like to offer integrated services for mental health and for youth. You have partnerships with all the different providers, and you have talked about what types of committed resources that could look like, whether that's funding or in-kind resources to support the development of the hub. Your steering committee is formed of the different partners, and you have determined a need to move along that continuum to close the service gap for youth in that area. So what do the two streams look like? Both streams, I will say, are to give us a sense of what your early thinking is. We know that things will change from what you write down on paper to what ends up being your final product at the end of this application process. So what we would like you to do is to walk us along what you are starting to think of for your community in terms of the organizational details. That's specifically the lead agency, as well as the partners who helped contribute to the development of the application. Help us understand what your community's needs are and your early vision. When it comes to the partners, we do need to understand what their roles would be and whether they're confirmed as partners or not. For capacity and readiness, it is absolutely okay if not all partners are confirmed and at the table. This stage is designed to help support building those relationships. We just need to get in a sense of the direction and who you think might be missing or who you think should be at the table. Same with services. What are you, given your community, your understanding of your community context, what are the services you think may be a part of your integrated hub? What will be the core values that your hub will encompass and model? And give us a sense of where you think your community's readiness is to continue this work. All in all, for capacity and readiness, it's your early thinking on where your community's at and where it is you would like to go and who you need to bring to the table to move your community forward in that way. That's the simplest way I can describe that application process. For plan and prepare, we're seeking to better understand what partners have formally signed off and are ready to work towards integration. That is, who's on your steering committee and how are they moving this work forward. We need to know and better understand what the foundations of your integrated hub are. So if you're applying for plan and prepare, we are going on the assumption that you have formally or informally moved through the exploration and design and capacity and readiness stages. We know that those are stages to our implementation framework, but there would be elements from your community discussions where you could demonstrate that you've gone through like-minded elements. So share with us what that foundation looks like. How did you get to where you are today? The initial planning of governance and management for your hub has been considered. Obviously not down to the operational level. That's something we'll work through together with the successful communities. But overall, what is that governance and management going to look like when you're bringing in multiple service providers? What steps do you have in place for ongoing monitoring and improvement? What are the resources that you think may be available to your community in the space? And what are some of the next steps that you need to take to move this forward for your community towards an initial implementation? In both application processes, you'll notice we didn't talk about evaluation specifically, rather about ongoing monitoring and improvement. For right now, PolicyWise will provide all evaluative support and will do so in your community context. We do have a provincial evaluation framework, but of course, each community looks a bit different, so it's being adapted slightly to best fit each community's needs, as well as align the data collection with what fits with your services so that it's sustainable after PolicyWise is no longer a part of it. So ongoing monitoring and improvement does encompass some of the evaluative elements, but for a lot of that evaluation components, PolicyWise will provide. So again, I've talked about the evaluation, but what else does PolicyWise provide within these application processes, or after the application, I guess? For capacity and readiness, PolicyWise will work with you to give you a sense of what your community level data looks like. This means that you know what your community looks like, but we are able to use data from our Child and Youth Data Lab to paint a picture of the service usage with the postal codes that you will provide us that makes sense for your community. That can help really inform service planning and give you a sense of what partners you may need to have at the table that may not already be there. PolicyWise will continue to provide you with guidance to work through the implementation framework through that capacity and readiness process in order to set you up for plan and prepare and ultimately implementation. PolicyWise will facilitate community planning meetings and discussions as is needed. We take our lead from you. We work very closely with each community, but we also work very differently with each community depending on what makes sense for their area. The $10,000 provided for capacity and readiness is to support the community moving forward with those ongoing discussions. There are parameters around what that funding can be used for, but it is quite broad because each community is quite different. Even with the funding we've provided to existing communities right now, they use it completely differently. One is using it for lease space and one of them is using it for staffing. So there is a fair amount of flexibility to use the funding in a way that makes sense for your community. we don't know what your in-kind resources are and the community contributions will be. And so we don't want to restrict what our funding can be used for if you have community partners who can provide in-kind resources in that way. So we'll work with communities to best understand where that makes sense to use that funding. Within Plan and Prepare, PolicyWise will facilitate implementation and steering committee meetings throughout. We will connect you with other communities who are in the implementation process. This is through often regular community meetings, whether it's implementation meetings or lead agency meetings. We will host summits about key topics such as mapping out your stepped care approach or just getting a better sense of the implementation process. And we will continue to work with you through the implementation framework throughout this whole process. So questions about the application process?
Is there any consideration of like a sliding scale between different size communities in regards to funding?
At this time, that hasn't been a consideration, but that doesn't mean that we wouldn't be open to further discussions. But for this call, because of it's been released in this way, that sliding scale likely wouldn't be implemented for this call, but potentially if there was any other future work. Other questions about the application process?
Hi, there was another question on the group chat about if a community was applying for the capacity and readiness, and if they decided to move forward, is there an opportunity to then apply for Plan and Prepare, or do you have to apply for both at the same time?
Oh, perfect. Thank you, Kyla. So typically, what we would encourage communities to do is to apply for either one or the other, not to necessarily apply for both. And because they are quite different in what comes out of the two calls. So a community that's moving forward to Plan and Prepare has established partners that have already outlined kind of what they're willing to contribute. Obviously, knowing it's quite conceptual, it may change as you move through, but fairly concrete in what they're willing to contribute and how the community will support the hub going forward. Capacity and readiness is much more of an exploratory process to help communities better understand what it would take to implement a hub. So it's about working through to understand who's missing from the table, what are some of those concrete contributions. So I don't imagine that most communities will apply for both streams at the same time. However, that said, there's nothing limiting saying that you can't apply for both streams. The second part of your question around if you move through capacity and readiness, would there be a future opportunity to apply for Plan and Prepare? At this point, I don't know what that will look like, but I do know that integrated hubs are a provincial priority, and there are discussions with the provincial collaborative governance and operating model to talk about how this can become more sustainable and continue to give communities opportunities that have started with capacity and readiness to then move forward. So I can't say for sure what that will end up looking like, but it is definitely discussions that are happening and part of the narrative at those provincial tables.
You've talked about having a banker. I'm wondering if, in fact, what is being asked for is a CBO or a community-based organization that would be consistent with the collective outcomes concept, or are you just looking for a banker?
No, so with both applications, what we're looking for is one agency to be nominated to be the lead agency. And that can be a community-based organization, absolutely. That lead agency, because it is a collaborative and partnership-oriented application process as well as delivery of services, the lead agency simply is the people that we can transfer the funds to. However, it is assumed that each partner would be contributing in their time and in their discussions through the steering committee to the hub. So in all honesty, I can say with the communities that we're working with, the lead agency, we have the same amount of contact with lead agencies as we do with the other partners at the table. It's just that that's who happens to hold the funds. So it's much more than just a banker, but it does have to be someone who can hold the funds from PolicyWise. Does that help answer that?
Right, but they aren't managing the process. They're, because we're using the community-based organization model in Housing First across our province. So it isn't that kind of responsibility. It's literally an agency that is prepared to and has the legal capacity to receive the funds and disperse the funds for the planning exercise.
Yeah, yeah.
Okay.
But it is assumed that, so it's a kind of a yes and no, so it's not exactly the same as Housing First, but it is assumed that the lead agency would also be an active member at the table, just like the other organizations. But there is the legal requirements of being able to hold and disperse funds. Yeah.
Okay.
And there was another question on the group chat on whether PolicyWise has thoughts around regional applications and geographic size of regions and the numbers of partners in communities.
Oh, that's a fantastic question. Yes, so PolicyWise will accept regional applications, as Parkland County is similar to that way, where it's an application on behalf of 2 different communities. I think this makes perfect sense, especially in rural and remote areas where it is partnering. There might only be one service provider in each community where you come together and bring those together to offer integrated services, perhaps in a mobile sense or an outreach type of sense. We don't have thoughts about the minimum number of partners, and that comes down to what we would like to see is that the evidence about integrated hubs is applied in your community context. So those evidence-informed approaches. So what I would encourage for any of those folks who are thinking about a regional application is tell us about your area. It's a similar process where you will still be describing your community, and that community definition would be the regional definition, needs, and why knitting together services from different communities is the best way to improve access and support for youth within those critical elements that are part of the environmental scan.
Is there an Indigenous stream?
There's not a specific Indigenous stream, no. However, the same answer would apply with Indigenous communities where if it is a, let's say like Musqueam, for example, where it's a number of reserves and First Nations communities who've come together to apply, that would be a welcome application. There are parts of the implementation where we ask for Indigenous culturally appropriate services to be a part of each community, each hub, regardless of where it's located per se. So there's not a dedicated stream, but there is an expectation that that is included in and discussed throughout the application.
Thanks.
And there was another question asking about the timelines to use the funds.
Oh, yeah, that's a great question. Well, this is where everything is community-based. So it goes with your stage of community readiness. So once applications are approved in May 2019, we will disperse the funds when you have a sense of where you want those funds to go. So for the 2 communities that we did provide funding to be honest, they both took them at very, very different points. So from the point of delivery to use of the funds, it's about 1 year, but there's an opportunity for extension if needed, because we know that community implementation processes take longer sometimes than on paper. So the formal answer is 1 year. But there is room for extension, and we haven't automatically released the funds when the application was instantly approved until communities had a sense of where they wanted that funding to go to. So it's been quite variable depending on which community we've been working with. But we would be ready to release it in May if the community was absolutely ready in May. Is there any other questions from the phone line? Just in final review, reminding folks that the applications are due on January 28th, 2019, and the panel review will be conducted through to March. And then those communities that are recommended to move into stage 2 of the application process will then fork off, depending on what the next steps looks like. Communities who do not move forward to the 2nd stage will receive feedback from the review panels in order to continue their work forward. I will say that PolicyWise has continued to work with a number of communities who weren't successful in the first application and share resources and lessons that we've been learning along the way. So if your community is committed to this and you aren't successful, there is opportunities for PolicyWise to continue to share resources and tools as they come available to us. If you have any questions that pop up, please don't hesitate to be in touch with myself or Val or Kyla. I think all of our emails are on the application processes and the information packages. And thank you very much for your time today, and we look forward to seeing your application.